there are some health conditions that can cause people to suffer depression, like chronic illnesses, chronic sicknesses that someone may suffer, like cancer or chronic pain, or things that that they go through physically that causes them to lose hope. There's maybe pain a lot all the time, and they may also lose their jobs as a result. Sometimes even lose family members who may just decide to leave. So sometimes health conditions will cause depression. And then there's also some medication that you may be suffering from a certain different illness, but the medication you get causes you to to suffer depression. So these are some of the things, these are some of the factors that may cause depression in different individuals. There are some people who suffer depression, but they don't seek help, or they don't want to talk about it, or they hide it. There are some people who hide the fact that they are having depression, or they are suffering depression. Why? One, there are some families or some cultures where mental health is not discussed, mental illnesses are not discussed. It's almost like taboo. And so for an individual who comes from such families or such cultures, they may suffer in silence because it is kind of not allowed to discuss things that have to do with mental health or mental illnesses. There are some people who feel ashamed. They feel they don't. It's like they don't want to look weird. They don't want to look abnormal. They feel like they're different from other people, so they feel ashamed to suffer to suffer depression, and so they kind of hide the fact that they are suffering in this. So they hide it from their friends, they hide it from their families, because they feel comfortable dealing with it, or rather admitting that they are suffering from this. There are some people who are uncomfortable when they feel vulnerable, when they feel like it's a weakness to admit that they have depression. They look at it like it's a disease that only weak people suffer. So for such individuals, they will hide that. They will not admit, or they will not seek help. There are those who also hide the fact that they're suffering because they tell themselves that they are able to deal with it. They are, they convince themselves, I don't have to involve anyone, I can deal with it. And yet there are still others who feel this is something that everybody suffers. It's a feeling that almost everybody goes through, so it's normal, I'll be able to get out of it. So there are those who may take it lightly and feel it's something that I don't have to involve anyone. Everyone suffers, I'll deal with it. And yet there are those others who feel if I admit to suffering depression, I may lose my job, or I may lose friends. And so they want to hide that from their friends, from their colleagues at work, because they don't want to lose friends. They don't want to, probably there are those who feel their relationships are going to be affected. They don't want to lose their partners when they discover that they are suffering depression. So all these are various reasons why a lot of people hide the fact that they're suffering from depression. But it is, as we said earlier, it is a disease, and it is common. A lot of people suffer it, but it was also highly, highly treatable. And nobody is, you can't blame yourself if you're suffering from depression. Just seek help. You will get it, share it with loved ones who care about you, and they will also help you to go through it. But how is depression treated? We said like between 80 and 90% of people who get this diagnosis of depression actually get treated. Almost all of them with proper diagnosis and proper treatment, almost 90% of them get help and they get well. So it is something that it is actually one of the highly treatable mental illnesses, that is depression. So uh, seek professional help. If you want to get, if you suffer from this and you feel you're not okay, seek professional help. A psychiatrist or a psychologist will make the assessment and they'll be able to tell you. They'll ask you a few questions. They'll, make the assessment and they'll be able to help you get into the, get the right treatment. Uh, and I will say that because it can be mild, moderate, or severe, your treatment will depend on where you are, on which in those three levels you are. So it can be treated through medication, and this is where your psychiatrist makes an assessment and decides you need to be put on medication. Antidepressants are very helpful and they will be able to help you. And this happens a lot, especially if it's severe, moderately severe, or really severe. If someone is suicidal, if there's that imbalance in your, chemicals, neurotransmitters, medication may be able to help you. Psychotherapy is another form of treatment where a mental health professional will be able to help. A lot of times, people suffering from depression, even if it's mild, it has to do with a lot of thoughts, self-talk, the wrong way of looking at things, the wrong way of judging situations. And a psychotherapist is going to help you to see things in a more balanced way, in a different perspective, so that you are able to get yourself off. One of the things that happen a lot when people are depressed is that there's a voice that speaks to in their minds and tells them all sorts of things, and that's why we mentioned blame and guilt and all that. It is simply a voice in their minds that tells them all these things about you: worthless, you're not likable, you're a failure, you will never make it, there's no way out for you. And a psychotherapist is going to help you to be able to deal with those voices that are speaking to you, and make you know that that is not who you really are. That is not yourself. Those are things, those are lies that you're entertaining, those are lies that you're listening to. And once you're able to challenge them, once you're able to combat them with the truth, they kind of just fade away. So medication will be able to help you. Psychotherapy is going to be able to help you. Sometimes a combination of both. It's a combination. It can be a combination of both talk therapy, that is psychotherapy, or and medication, or either. If it is mild, sometimes you don't really need medication. But like I said, an assessment by a mental health professional is going to be able to help you get to the right mode of treatment. But even if you do not, even if you're on that level of mild, it's really not that major or moderate, or however it is. There are still certain ways, even if you're not on medication, there are certain ways you can be able to help yourself, so that you are able to conquer this disease, you're able to deal with it, and you're able to live well, you're able to live a productive life. So one of the things that you can do to help yourself is, one, recognize that it is a disease, just like any other disease, just like any other disease that anyone can suffer. So don't give it a name that is not it, that doesn't belong to it. It's not something. It's not witchcraft. It's not something that someone threw at you because you did something wrong to them. It is a disease like any other disease, and you will be able to deal with it once you give it proper attention. Don't allow yourself to suffer the stigma that a lot of people suffer, because they feel like it's beyond, it's something beyond a disease. So seek medical and physical and mental help that will be able to help you deal with it. Know that it is a disease. Depression is a disease. It is common and it is treatable. That is one of the truths that you have to really embrace in order to be able to combat it. Secondly, recognize and conquer the inner critic. I said a lot of times people with depression entertain a lot of talk, a lot of voices inside of them that tell them all sorts of things negative about them. it is important to know that this voice is your worst enemy. Because even if you're on medication and you're still entertaining those thoughts, it will be harder for you to, get well. So get rid of that voice that speaks to you negative things about you and pulls you down and makes you feel that you can't really get out of it. So conquer that inner critic. Do not listen to it. It is not the truth. And if you want to know that it is a deception, just look at your life. If it tells you that you're hopeless, if it tells you that you're a failure, if it tells you that you can never be able to go through this, you just need to look back into your life and look at some of the areas that you are able to really go through some challenges, that you're able to make to be successful, whether at work, at home. If you're a parent, you're able to raise your children. If if you're an adult, you went through so much to be able to get to where you are. If it is at work, you've come a long way. And so there are very many proofs around you to tell you that that voice is wrong. That voice is a deception. So conquer that inner critic. That is number 2. Number 3, get up and be active. And this sounds a little bit ironic for someone who is suffering depression, because one of the things that is very hard for them is to be active. But being active, whatever activity it is, whether it is walking, whether it is just doing some activity around the house, around the yard, that causes your heart to beat a little faster, to break a sweat, that activity is going to raise a lot of is going to release the feel good hormones that uplift your mood and causes you to feel better. So make an effort to be active in whatever way, whether it is a brisk walk. If you walk briskly, like for 30 minutes for 4 or 5 days a week, you will notice an immediate change in your mood. So get up and be active. Resist the temptation to just sit around or sleep. So that is one of the ways that you can be able to beat depression. Number 4, resist the temptation to self-isolate. Depression causes you to want to be alone. And this kind of aggravates the feelings anyway. So you isolate, and the more you are alone, the more your thoughts now go inwards, and you're not able to. It becomes very hard for you now to even help yourself. So as much as you may want to be alone, this is the time you need to have a really social, a vibrant social atmosphere around you. So hang around friends, hang around family members. If there are people you have around you who care about you, like family members who really love you and care about you, just share how you're feeling, but just resist that desire to be alone, because that is going to cause you to really remain in that mood. So don't self-isolate. Just do your best to be around people, and especially people who care about you, and love and care about you, so they will help you. But even if you don't share with everyone, just hanging around people, listening to them talk, listening to them laugh, watching what they're watching, engaging with them is going to help you. The other one is do something that makes you happy. Just make an effort. I keep saying make an effort because it's really a struggle for someone in depression to want to do things that they once enjoyed, engaging in hobbies or things that they find interesting or things that they love to do, because depression makes you just feel hopeless. But make an effort to do the things that make you happy, things that you love doing, whatever it is, whether it's reading a book, whether it's watching a nice movie or a comedy or or playing a game, or whatever hobbies you like engaging in, or you used to like engaging in before you started feeling that way. Just engage in that. That starts working on your moods even before you realize it, and before long you notice that your depression is being pushed back. Push yourself to do those things that you love doing, that you would love, that makes you happy, and you will notice that your spirits are lifting and you're feeling much better. I would like to say that if you know someone who is struggling with depression, it may be a friend, it may be a family member, it may be a colleague at work, you may need to help them. The reason is because a lot of times the depressed person may not even have the energy to find help for themselves. They may not be able, they may find it very difficult to seek help for themselves. So those around them may be the ones to help. So if you know or notice someone near you looks like they may be suffering depression, you may just take it upon yourself to find help for them, and that is going to really be helpful to them because they may not have the energy to do it, they may not feel like doing it, and you will be the help that they need. So that's a little bit about depression, and thank you for tuning in today. We will see you next time.